I think the hospital side of it ran very smoothly actually. She went in for her operation. She had bilateral femoral osteotomies and pelvic osteotomies, so they worked on both sides. And so it did take a long time. It was about 7 hours altogether that we had to wait for her to come out. But I mean, surprisingly, she was very good when she came out. I think the main complication we had was spasms. And we think they were spasms because, of course, Sophie can't tell us. So I think the main thing was trying to get the pain management right. And this is an issue throughout, from the operation to the management of the hip spica to afterwards when it's removed as well. Pain management is very difficult, and generally the way you approach it with Sophie and many other children who can't communicate is just give as maximum as you can for as long as you can, because you can never anticipate whether it really is hurting or not. She did wake up a lot of times in the night with spasms, and we had to give her medication for that in the hospital. But generally, the children are very, very, very good about it. They work through it, and she came through it admirably, really. And it was near Christmas, and there was plenty going on. We had visitations from Everton Football Club, Liverpool Football Club, Father Christmas came. So there was lots of distractions as well. So it really helped us and her get through the hospital time very well. And we were able to come out for Christmas Eve, which was fantastic, yeah. I would say that Sophie didn't actually stay in hospital any longer than would have been anticipated anyway. In fact, she could have come out a day earlier, but because we were a long way from the hospital and we couldn't transport her in a car, they had to order an ambulance. And you can imagine the amount of ambulance being ordered at Christmas was quite significant. So we were quite lucky to get out when we did, but she could have actually stayed in a day less, because we were very comfortable about bringing her home and managing her, because she'd had the previous hip spica when she was 2. So we felt very comfortable ourselves on how to manage her, yeah. Sophie has a lot of medication throughout her life, and she has had, since she was 1, various conditions, and so she's always had to take medicine every day of her life. And I suppose really to her now it's like having a drink, and we're able to give her any type of medicine, and they make them so nicely flavoured that I'm sure she doesn't mind it at all. It's very rare that I would find a medicine that she doesn't like. So we were able to give her the main painkillers such as diclofenac, codeine, the paracetamol, ibuprofen. She was able to have the whole lot, and she was quite happy to swallow them, no problem. So we're very lucky in that, but I know a lot of other people with special needs children who require almost sedation to have a vaccine, for example. So every child is very different, and I think because Sophie has to take medicine every day, she sees it as an everyday task.
Lovely.